Hello everyone, I am myself Dr. Rajesh Gubba. I am the General Medicine Educator. So in this session, I'll be discussing the quiz which I have posted on my Telegram channel on 21st of May, that is on Medicine Made Easy by Dr. Rajesh Gubba. So that is my Telegram channel. Every day I am posting the quiz and on the subsequent day I am sending the explanation as well. So as a part of it, let me discuss the first question. Myasthenia gravis is caused by dysfunction of, the options are the pineal gland, thymus gland, pituitary gland, parathyroid gland. So myasthenia gravis, which is a neuromuscular junction disorder, it is caused by the dysfunction of the thymus gland. And what will be the thymic abnormality? So it is either thymoma or thymic hyperplasia. So that is the reason why these patients, they have to undergo thymectomy as a part of the treatment. And this particular thymectomy should be done in the individuals of age group 15 to 55 years. And thymectomy should not be done in case of, should not be done in case of ocular myasthenia gravis. Thymectomy should not be done. Then age of the individual less than 55 years or age of the individual more than 55 years, thymectomy should not be done. So this is about the myasthenia gravis caused by dysfunction of the thymus gland. And if you see the next question, all of the following are true regarding inclusion body myositis except males are more commonly affected than females, pharyngeal muscles are affected, muscle biopsy shows perifascicular inflammation, inclusion body myositis is resistant to the immunosuppressive therapy. So if you take this inclusion body myositis, yes, males, they are more commonly affected than females. And in these individuals, there will be involvement of the muscle weakness and including the pharyngeal muscles. And that is the reason why they will have the presentation in the form of dysphagia also. But if you take this muscle biopsy shows perifascicular inflammation is a wrong statement. In case of inclusion body myositis, what is that you will observe in the biopsy is you will have the presence of vacuolated fibers. That will be the biopsy picture in patients with the inclusion body myositis. And this inclusion body myositis, the treatment is just only supportive treatment. They don't respond to the immunosuppressive therapy, right? They don't respond even to the anti-inflammatory drugs. Okay, so there is poor response to the anti-inflammatory and as well as the immunosuppressive therapies. Okay, so muscle biopsy, it shows the vacuolar inflammation. So this is what is your vacuolated fibers that you will come across in patients with the inclusion body myositis. Next, another important question is regarding the Duchenne's muscular dystrophy. It is a disease of neuromuscular junction, sarcolemmal protein, muscle contractile proteins, disuse atrophy due to muscle weakness. So if you take neuromuscular junction disorder, that will be myasthenia gravis, and the next important one is Lambert-Eaton myasthenic syndrome. Whereas Duchenne's muscular dystrophy, it is an inherited disorder. It is the disorder of the sarcolemmal protein, right? And the type of inheritance will be the X-linked inheritance that you come across in patients with Duchenne's muscular dystrophy. And where is that you come across this disuse atrophy due to muscle weakness? Disuse atrophy due to muscle weakness, you come across this in patients with upper motor neuron lesion. And if you see some of the important points about the Duchenne's muscular dystrophy, it is the one where the individual will have a classical sign called as the Gower sign. And this particular Gower sign, it is due to weakness of the quadriceps muscle, which is the proximal muscles of the lower limbs, where the individual will not be able to stand from sitting position. And in order to stand, the individual has to climb on himself. Okay, the individual has to climb on himself to attain this standing position. Okay, so that is what is called as Gower sign, and that is due to the weakness of the quadriceps muscle. And if you take the calf muscles in these individuals, there will be hypertrophy, and it is not a normal hypertrophy. It is the pseudo hypertrophy that you will come across in patients with the Duchenne's muscular dystrophy. Pseudo hypertrophy means the skeletal muscle, whatever is there, that is replaced by the fat, right? And it is replaced by the connective tissue. Okay, so that is what is the pseudo hypertrophy of the calf muscles. And the next important is there will be also loss of muscle strength, which is progressive in nature. And you have to understand that the proximal muscles, they are the one which are commonly affected then compared to that of the distal muscles. That is what you see in patients with the Duchenne's muscular dystrophy. And leg involvement is more severe than compared to that of the arm involvement. That means lower limbs are more commonly affected than compared to that of the upper limbs. And another important point is there will be contractures of the heel cords and as well as the iliotibial bands. And if you take the spine of these individuals, there will be progressive scoliosis that you come across in the spine of these individuals with Duchenne's muscular dystrophy. Okay, so this is about Duchenne's. And you also need to know what is the age of onset of Duchenne's muscular dystrophy. The age of onset will be around 3 to 5 years. And these patients, they are bound to wheelchair where they have inability to walk at the age of 12 years. And they develop respiratory failure around 2nd to 3rd decade of life where the individuals succumb to mortality. So usually after 16 to 18 years, they start developing the respiratory muscle weakness and thereby they will develop respiratory failure. Okay, so that is about your Duchenne's muscular dystrophy. The next important question is, which of the following is least commonly involved in myasthenia gravis? The cranial nerve 3, cranial nerve 9, cranial nerve 10, cranial nerve 12. So this myasthenia gravis, it is the disorder of the neuromuscular junction, right? And it is mainly the motor component which gets affected in patients with the myasthenia gravis, whereas the sensory involvement in myasthenia gravis, it is very less or it is rare in patients with myasthenia gravis. Now out of these cranial nerves, you take this cranial nerve 9, that is glossopharyngeal nerve. It is concerned with the sensory sensations which are being carried from posterior 1/3 of the tongue, right? So from posterior 1/3 of the tongue, the sensory sensations are being carried. So once this ninth nerve is affected, the taste sensation from posterior 1/3 of the tongue is being lost. So you have to understand that in myasthenia gravis, the ninth nerve is least affected, whereas the remaining 3, 10 and as well as 12, they have the motor component which can get affected by your myasthenia gravis. Okay, but the one which is least commonly involved in myasthenia is the glossopharyngeal nerve, right? Then coming to the next question on the Alzheimer's disease. All of the following are the risk factors for Alzheimer's disease except old age, positive family history, female gender, ApoE2 gene. So if you take the risk factors in Alzheimer's, Alzheimer's is what? It is a form of the cortical dementia. And this particular cortical dementia, it is seen in the elderly individuals of age group more than 60 years. So old age, it is one of the risk factor for the development of the Alzheimer's. And which particular structure is affected in Alzheimer's? It is mainly the hippocampus which is being affected in the Alzheimer's. And you have the accumulation of the intracellular and as well as the extracellular inclusions. And positive family history is also a risk factor. And female gender is also a risk factor. Females, they are more prone for Alzheimer's than compared to males. And it is not your ApoE2 gene, it is your ApoE4 gene presence is the risk factor. So the question asked is except, the answer is ApoE2 gene. And what are the other risk factors for the Alzheimer's? Having low education level, that is also, right, having low education level, that is also the risk factor for the Alzheimer's. Okay, and apart from that, we have some numerous environmental factors. What are those environmental factors? That includes example like exposure to the aluminum or aluminum toxicity, exposure to mercury, exposure to viruses, and as well as the prion disease. These are the other risk factors for the development of the Alzheimer's. Apart from that, we also have some genetic factors or some mutations which can contribute to increased risk of the Alzheimer's. Now, what are those mutations? These particular mutations, they include APP, that is a mnemonic. What does this APP stands for? This APP stands for amyloid precursor protein, which is present on chromosome 21. Presenilin 1, which is present on chromosome 14. Presenilin 2, which is present on the chromosome 1. So the genetic factors which contribute to the development of the Alzheimer's, these are the genetic factors. And you have to know that there are some factors which decrease the risk of the Alzheimer's. Now, what are those factors which will decrease the risk of the Alzheimer's? They include, number 1, postmenopausal estrogen use. that will decrease the risk of the Alzheimer's. Next is the usage of the non-steroidal anti-inflammatory drugs. Even they also decrease the risk of the Alzheimer's. So now in the question, it is not your ApoE2, it is your ApoE4 which will be the risk for the development of Alzheimer's disease. So this is about the questions which I have posted on 21st of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So for everyday daily quiz discussion, join my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. Thank you very much. See you tomorrow again.